What are the most effective treatments for scoliosis? Hi, I'm Dr. Gubbels from ScoliCare Denver, and in this video, I'm going to cover the most effective treatments for scoliosis. Now, scoliosis is a condition that's really affected by millions of people worldwide, yet it's really widely misunderstood. Now, as a scoliosis specialist, I've encountered numerous misconceptions about causes, symptoms, and even treatment options for scoliosis, both from patients, but also from other healthcare providers. So in this video, I aim to clear up all those misconceptions. Now, what exactly is scoliosis? Scoliosis is a three-dimensional spine deformity characterized by a lateral curvature on the spine with rotation. Typically, it looks like an S or a C shape when viewed on an X-ray. Now, it can vary in severity, ranging from mild curves to more pronounced severe deformities. And while scoliosis often develops during adolescence, adults also experience scoliosis, either as a progressive scoliosis that developed when they were younger, or potentially a new degenerative scoliosis that actually develops in adulthood. Now, from a clinical standpoint, someone has an official scoliosis diagnosis when they have at least 10 degrees of lateral bending, measured using the Cobb angle method of measurement on an X-ray, and there must be rotation present too. Now, if left untreated, severe scoliosis can lead to pain, disability, impaired lung, potentially heart function, but really reduce the overall quality of life. So what exactly causes scoliosis? Now, the causes of scoliosis are categorized in different categories. The most common type of scoliosis is idiopathic scoliosis. In fact, 80% of all scoliosis are idiopathic. And the word idiopathic on its own means we don't know the exact cause. Now, it commonly develops, or idiopathic scoliosis typically develops during adolescence, and it's possibly or probably related to some genetic factors and some environmental factors that trigger the genes to cause the bones to grow asymmetrical. Another type of scoliosis is known as congenital scoliosis. Now, this actually results from malformations of the spine and vertebrae that are present at birth. These abnormalities often occur, they actually develop during fetal development, and as someone's born, the vertebrae are asymmetrically shaped, and sometimes they're even fused together. Neuromuscular scoliosis is a form of scoliosis that we frequently see in our office, and it can be caused by underlying conditions such as cerebral palsy, muscular dystrophy, it could be a spinal cord injury, it could be a tumor, and some other conditions as well. Now, how neuromuscular scoliosis typically develops in cases of someone like cerebral palsy or muscular dystrophy, their neuromuscular function is not able to hold their body upright, so their body begins to break down or collapse, and that causes the deformity to develop. If someone has something like a spinal cord tumor or a syrinx, or there's tethering where the spinal cord becomes attached to the inside of the bones or the spinal canal, that can actually trigger or cause the bones and the spine to actually start to twist and grow asymmetrical. So still neurological scoliosis, but its mechanism or how it develops is a little bit different. And then we have degenerative scoliosis. A degenerative scoliosis could be someone that has this scoliosis when they're younger and it starts to break down and decay when they're an adult, but there's also something called as a degenerative de novo scoliosis, which is a new scoliosis that actually develops in adulthood, typically from the disc breaking down and some of the other joints starting to break down with arthritis, like the facet joints, and over time it progresses and it gets more and more severe over time. Now, if you're liking this content, be sure and give us a thumbs up and hit that subscribe button down below. Now, understand the underlying cause of scoliosis is really critical for determining the most effective treatment options. So what are some of the most common signs and symptoms of scoliosis? Now, these signs and symptoms can vary depending on the severity of the condition. Some of the ones you want to look for are uneven shoulders or possibly uneven hips. You may notice your belt or your waistline looks uneven when you look at yourself in the mirror. Prominent ribs or a humping in the rib indicates potential thoracic scoliosis. Asymmetrical waistline. One side is flat and one side is more indented, indicating a possible lumbar scoliosis. One of your shoulder blades sticking out or protruding in the back more than the other side. Like you can see the shoulder blades do not look the same, they look uneven. And then chronic pain. People with scoliosis tend to get pain, especially in adulthood, and back pain is more common in someone with scoliosis compared to someone without scoliosis. Also, the pain patterns tend to present a little bit different in adults. Adults with scoliosis typically have asymmetrical pain, and the pain is typically on the side of their scoliosis, and it's generally the most severe at the peak of the scoliosis. Also, adults with scoliosis tend to get pain. If they get it radiating pain, it tends to be in their lateral thigh or in the anterior thigh, because the peak of the curve tends to be higher in the lumbar spine, where the nerves of the anterior thigh control. This compared to someone without scoliosis generally more has symmetrical back pain, generally lower in the spine, and oftentimes radiating pain going down the back of their leg, otherwise known as sciatica. Severe curves can also lead to breathing difficulties, typically when a curve gets beyond like 70 degrees, and then pain. Like I said, pain is a common thing, and associated with pain and alignment is also loss of balance. A lot of adults with severe spine deformity do start to develop balance issues, which increase someone's risk of falls. In adults typically experience stiffness in the spine, muscle spasms, and nerve or spine related pain. That's typically the driving factor for treatment is for pain relief and to stop progression. It's really important to know some of the signs and symptoms of scoliosis, because we know the earlier we detect something, the earlier we can get more appropriate treatments, and the earlier we get better treatments, the better the long-term outcomes. So what are the most effective treatment options for scoliosis? The approach to treating scoliosis depends on several factors such as age, the degree of scoliosis, severity of symptoms, and really the risk of curve progression. So here are some of the primary or the most effective treatment options. Targeted or scoliosis-specific exercise that actually aim to improve posture, strengthen the spinal muscles, and reduce the risk of curve progression, and in some cases, reducing the size of the curve. Techniques like ScoliBalance, which we use at ScoliCare, Schroth, SEAS, which is scientific exercise approach to scoliosis, and a few others have been shown highly effective at treating scoliosis. Now, SOSORT, the International Society on Scoliosis, Orthopedic, and Rehabilitation Treatment, actually has 4 criteria that need to be met for something to be considered a scoliosis-specific exercise. Those are: 1, you have to teach the patient how to put their body in a correct position. 2, you have to strengthen and stabilize the spine while the patient is holding their body in a correct position. 3, you have to incorporate activities in daily living, meaning you have to teach the patient how to do things they already do in their everyday life with their spine in a correct position. And 4, education. Education is an important part because if a patient really understands what's happening in their body, they're going to be more effective at being actively involved in their treatment. So let's talk about scoliosis bracing. Bracing is typically recommended for growing adolescents or even juveniles when their curves get between 25 and 45 degrees and they're still growing. There's also evidence to support bracing in curves up to 60 degrees. In adults, bracing is frequently used to stop or slow progression and dramatically reduce pain. And it's interesting, when I find in the orthopedic world, many people are really not informed or misunderstand the idea of bracing for adults with scoliosis. Many orthopedic doctors have never even heard of the concept, but there's some great research to show the right kind of custom braces can be highly effective in treating adults. The thing about braces is not all braces are the same. Bad braces or poor braces get a bad result. Good braces can get a good result. A recent study done by ScoliCare in a hospital found that when wearing a Scoli brace, adolescents had an over 80% positive outcome in reducing their risk of progressing to surgery, and the majority of the patients actually had a reduction in the size of the curve. So the right brace for the right patient can get a terrific result. Now, modern braces like the one we use with Scoli brace, they're different than the old braces. They're generally more effective and more comfortable. Where modern braces almost work like a cast, where they work to squeeze the spine and just try to hold it there in hopes it doesn't get worse. And a lot of older braces don't even attempt to try and reduce the size of the curve. Bracing can prevent progression, it can improve alignment in the right cases, it can relieve pain, and it can really enhance the quality of someone's life. And then there's surgery. Someone becomes a candidate for surgery when their curves get between 45 and 50 degrees. That's typically when surgery may be recommended for a growing adolescent. Now, just because someone becomes a candidate for surgery doesn't mean they have to have surgery. Surgery in adults is typically there to help relieve pain and prescribe when other things have not been successful. The goal of scoliosis surgery in many cases is to reduce the size of the curve, to stabilize the spine. In adults, really reduce pain and enhance quality of living. Sometimes surgery is the only option. However, the goals of surgery are the same as the goals of non-surgery: reduce progression, relieve pain, and enhance quality of life. But there's also inherent risks that can come along with surgery, such as long recovery time, infection, a failed union of a fusion, and then a lot of people even need revisions or secondary surgeries after their initial one. So although surgery may be required, it should always be the last resort and only be considered when all conservative methods have failed. Now, the other thing that someone should consider are other conjunctive treatments that can be utilized with scoliosis-specific treatment to help help with pain management. And there are many different things someone can do, and along with scoliosis-specific treatment to reduce pain. One of those is chiropractic adjustments. Chiropractic adjustments are highly effective in increasing spinal mobility, reducing pain, improving overall function, and a lot of times improving health. So although they don't stop the progression of the curve, they can help with scoliosis treatment by increasing spinal mobility and reducing pain. Acupuncture. Now, acupuncture works by targeting pressure points to alleviate pain, improve function, and increase overall blood flow. And while it doesn't correct the spine, it can be effective in some cases in providing pain relief. Massage therapy. Specifically, when we think of massage therapy, we want to look at deep tissue myofascial release techniques. These can reduce muscle tension, they can improve circulation, and they can just really improve overall comfort and alleviate discomfort associated with scoliosis. Yoga. Now, yoga is something that a lot of my patients are involved in, and yoga can be good at increasing mobility and increasing strength and stability, and a lot of times helping reduce pain. It's just not going to change how the scoliosis progresses. If you're doing yoga, though, it's important to work with a scoliosis specialist to make sure that you modify your yoga poses to make sure they're enhancing and not hurting your scoliosis. General physical therapy can also be used. It's different than scoliosis-specific physical therapy, but it can be used to increase mobility, improve things like posture and balance, strengthen and stabilize the spine, and possibly help reduction of just overall pain levels. And then we have over-the-counter pain medications, things like aspirin, ibuprofen, which is a non-steroidal anti-inflammatory. These can reduce pain, and they can by reducing inflammation, but they should only be used short-term. You shouldn't be taking these every day, and that can be very harmful because they can actually lead to digestive issues, because although they stop inflammation, they also reduce the production of the cells that line your digestive system. And then we have other things frequently offered in pain management, like epidural injections or facet injections or radiofrequency ablation. These things can be effective for short-term pain relief. Epidural injections reduce inflammation, which temporarily reduces the pain. The other thing, though, steroids also weaken some of the connective tissues. If you have pain coming from the facet joints, radiofrequency ablation can burn the nerves, which temporarily reduces the pain, but those nerves do grow back. Also, there are some studies that show repeated or serial radiofrequency ablation can lead to weakness of your multifidus muscles, which are these tiny little muscles in your spine that are responsible for stabilization and coordinating movements of your spine. So if you need those things, you just don't want to overdo it and know it's a short-term result. And then one of my favorites for pain relief is non-surgical spinal decompression. This can be a great option for adults with degenerative scoliosis. Non-surgical spinal decompression works by pulling on your spine, increasing the space between the vertebrae, a lot of times helping disc repair, recuperate, sometimes even leading to an increase in disc height, but it also takes the pressure off painful facet joints. So this can be used for adults with degenerative scoliosis, but you want to do this in conjunction with stabilizing things like scoliosis-specific exercises. So the most important thing is making sure you get the right treatment at the right time. Every patient is different, and their care needs to be customized to them. At ScoliCare, we specialize in scoliosis-specific exercises utilizing ScoliBalance and custom bracing utilizing ScoliBrace. Now, if you're watching this and you or someone else you know in your family has scoliosis, you can click on the link below and you can actually request a free discovery call. And this is a chance to talk with me for about 15 minutes where we will go over your case. If you send me your x-rays, I'll actually review your x-rays with you, and I'll let you know what your potential treatment options are. You can also click on a link to download a free ebook to learn more about effectively treating scoliosis without surgery. Lastly, if you like this content and you find it helpful, be sure to hit that subscribe button so you're notified when we release new content, and always give us that thumbs up.